Hello everyone. So in this video we are going to speak about the workplace-based assessment. So like OSATS, mini-KICs and case-based discussion. So these are forms of assessment which you can request while you are working from your senior colleagues. So why I'm explaining this station today, because sometimes while you are in the exam doing a teaching station, the trainee who is coming to learn about any event can ask you to sign him a form, which can be formative or summative OSAT. Okay, and as an overseas candidate, you may not be really familiar with these forms, and you may think about whether it is safe to sign this form. Is it not safe to sign it? Some people may tell you, yeah, you can sign the formative, but don't sign the summative form. And others will tell you, don't sign any form in the exam. It's not your responsibility to give a competency to a trainee, even if he did everything well. So I'm going to explain to you today what is the workplace-based assessment form and what is the difference between the formative OSAT and the summative OSAT. And by the end of this station or session, we will know whether we can sign the form in the exam or no. Okay? So first of all, what are the types of workplace-based assessment? So we have what we called mini KICs. We have the case-based discussion or CBD and the OSAT. So what are these kind of weird terms? First of all, I'm going to speak about mini KICs. What is mini KICs? These are assessment of communication with patient, with colleagues. If you want to be assessed about your history taking, about your examination, about your investigation interpretation, about counseling the patients, you have got a patient who had a previous C-section and she came today asking for the mode of delivery, like she's 20 weeks in her second pregnancy and she came for discussing about the mode of delivery, and you find yourself competent in doing this counseling. So you will go to your senior and ask him to come and see you while you are counseling the patient about her mode of delivery, and then sign for you a feedback about your performance. So that's like a mini KICs. So a mini KICs can include taking a history, taking a consent from the patient, doing examination on a patient, like if you want to do like a speculum examination and you want to show your competency in that, so you will ask your senior, can you see me while doing a speculum and sign a form for me? That's a mini KICs. It can't be OSAT. Okay, like putting a plan of management and discuss it with the patient, like a patient who is like, for example, postmenopausal lady came with an ovarian cyst and her CA125 or tumor markers are normal. So you made a plan that this patient needs laparoscopic bilateral salpingio-oophorectomy, and you start to discuss with her the plan of management, take her queries in your consideration, and discussing the possible benefits and risk from this procedure, and you want to be assessed for that. So you call your senior to see you while you are dealing with the patient, counseling her about and discussing the management plan, and then ask him to give you a feedback about what you have done. So that's a mini KICs. Okay, so that's a very different form of assessment, is not the OSAT. So the second one is case-based discussion. What is the meaning of case-based discussion? So your supervisor or your senior trainee is sitting with you in a meeting, like not in a formal meeting, like you and your colleagues are sitting together in like a scientific like talk, and then your senior put a scenario and start to discuss the case, and he's telling about what's your opinion, what's your plan of management. He's just discussing the case with you step by step. So that's called case-based discussion. Okay, it can be also like a clinical scenario when you face a patient in the outpatient clinic and you feel that you managed this patient very, very well, and then you go and report what you have done with the patient to your consultant. If your consultant is happy with your management plan and discussion and everything, then you can let him sign for you a case-based discussion. So that's also a different thing rather than the OSAT. So what about OSAT? OSAT is called objective structured assessment of technical skills. So we assess the technical skills with the OSATs. That means we have to do a procedure. What kind of procedure can be included in the OSAT? It can be like opening and closing the abdomen. It can be repair of episiotomy, perineal repair, doing fetal blood sampling, doing manual removal of placenta, hysteroscopy, laparoscopy, cesarean section. So procedure, okay? So you are doing procedure, and then that's the technical skill. So you are getting structured assessment of your technical skill, and it is objectives, mean that the person who will sign your form has to object you and supervise you and see you while you are doing this procedure, and then he will sign you the form. And that's a process called signing off. Okay, so that's actually on the screen. What's shown in the screen is my own training e-portfolio. I just put it for you just to be aware about the new formative and summative OSATs. Okay, so that's how the training e-portfolio looks like. Okay, so when I want to send an OSAT form for anyone to sign it for me, so I need to fill all these gaps. I will just try to do one in front of you now, just to show you how it is done, and like to tell you the idea. So first of all, let's speak about formative OSATs. What is the meaning of formative OSATs? It's just a supervised learning event. What is the meaning of supervised learning event? That means like imagine you are a senior person, the most senior person in the labor ward, and you have got a new trainee joined the department today. Okay, so he is just starting his job, and you feel that he's doing well and he has initiative to learn and so on. So you call him and ask, have you conducted any deliveries before? He will tell you like yes or no, whatever. So have you sutured any episiotomy before? He will tell you no, I haven't done that before. Then you tell him, okay, come with me, I will do it for you today. Okay, and you see me now, and next time I will let you do it under my supervision. That's what is going on everywhere in the world, right? Yeah. So today he have seen you. You teach him well, step by step. Here I'm suturing the mucosa, here's the muscle, here's the skin, that's blah, blah, blah. And then you finished all the thing. And then the next case, you call him and you ask him to show you where is the apex, and take the first stitch and continue the vaginal mucosa, and then you take over and continue the remaining. And next time he is doing the mucosa and the muscle, and next time he will do the full episiotomy, all of that under your supervision. So that's a supervised learning event. He can send you a formative OSAT with each time you are giving the learning points for him. And you will just sign. There is no overall judgment here. You can't tell this trainee is competent or not competent in doing this procedure. He's just learning now. We are not in a status of comment on his performance at all. It's just a feedback for what he has done and what could have been done better and what is the learning plan. So, for example, if I'm going to fill this form, like, I will suppose that I am now today attended like a learning event with my consultant, and he taught me how to do endometrial ablation. Okay, so I asked him before I'm going ahead, can I send you a formative OSAT for that? He agreed, and then we will go ahead. So he already gave me all the information, and I followed the instruction, and everything went well. Okay, and then I'm in the process of filling the OSAT. So the name, I will just state like endometrial ablation here. Okay, and then the key skill. So here I can choose non-emergency gynae. For example, okay. So because it is presetted in the Royal College, you will find many curriculum there. So you need to choose the correct key skill. So we'll just state gynae again. We'll choose that one, for example, okay. And then I have to choose the date for which the assessment has been done. So I will choose today's date, for example, and the category is gynae, and the procedure again is called endometrial ablation. So I'll choose that one. Here I need to state what are the clinical details of the patient, like I will like tell para 2 with heavy menstrual bleeding, and so on, what happened, and everything about the clinical details. Here I will state what went well. So I can just count here number 1. For example, we have done a diagnostic hysteroscopy in the beginning, and we confirmed the cavity is normal. We have done the endometrial biopsy, and it was normal. We already adjusted the endometrial ablation, the Novasure, and we measured the cavity dimension up and down, side to side, and we operated the system, and it was successful operation. We can just state what went well and what could have done better. So what could have gone better? Anything like, like proper positioning of the patient, or like patient has not been given any patient information leaflet in the clinic, so we have given her before the procedure. Whatever, you can think that what could have gone better, you can just write here. And what is the learning plan? My learning plan is to do lots of endometrial ablation to feel confident to do it independently. Okay, so I'll just state that here, and then I will not add anything here in the assessor additional comments. That's the box where the assessor can write whatever needed. Okay, and here the trainee reflection. So whatever the assessor write here, like for example, I didn't write any comments upon on my performance. So sometimes the assessor or the consultant or your senior may see that you didn't like do this in a proper way, like when you grasp the cervix, you were putting too much trauma and it got some bleeding, so next time try to be gentle. For example, he can write that here. Okay, so I'll follow that with the reflection. Yes, I see that, and next time I'll try to be more gentle than this time. Thank you for your feedback. Okay, so the reflection, that means you have read the comment from the assessor and what is your reflection on that. And then here you can choose the name of your assessor, like yeah, if you start to write the first few letters of your assessor, you will find his name stored already in the Royal College, or if you can just put your assessor email and the role of your assessor. You can see that the healthcare worker can sign forms for you, the administrator, the management, the nurse, the midwife, everyone can sign specific form for you. Like if you are dealing with the patient or doing episiotomy and the midwife have seen you, you can send her to give you a feedback. Okay, so there is no word here telling whether you are competent or not competent to do the procedure. It's just a learning event. As I told you, it's a supervised learning event. So it's one of the unprofessional thing when one of your colleague asks you to sign for him that he is learning something, and you tell no, I will not sign that. Okay, because you will sign, that doesn't mean that he is allowed to go and work independently. He's just learning. He's proving that he's progressing in his career. Okay, so he will keep doing formative OSATs. There is no limit of doing formative OSATs until he think that he's really competent and confident in himself to do this procedure. Then he will start doing the summative ones. Okay, so again, the formative OSAT is, if you are the supervisor one, it's just a tool to give a feedback to your trainee about the performance of the procedure. And there is no overall judgment here regarding the competence for the event. It's just a supervised learning event. And if I'm the trainee, I'm the one who is requesting this from my senior, I need to do everything as far as I know properly, so that I will have more confidence and more better, like, feedbacks. It's just a feedback. It's whether it is right or wrong. You feel free to write anything here in what went well, what could have been done better, and what is the learning plan, and what are the additional comments. You can even modify the words that he has written before, like, even if whatever I wrote here and I sent to my assessor, he can modify whatever I wrote. Like, it doesn't mean that if I wrote like I did everything well, and the assessor read that, he can just modify, he can modify everything and formulate to the way that he is satisfied for. So, and that's very important for progression of the training. Like, I can't proceed for my OSAT, my summative ones, unless I have very satisfying formative ones. If I've got formative ones, which is telling that I'm not looking my needle all the time, and that put my colleagues at risk of of injury and infection, that and that's repeated in many of my formative OSATs. I will be feeling not good, that I need to modify that. I need to learn how to look my needle. I need to tie the suture well in a proper way. I need so all the feedbacks will give me learning points. So that's the formative OSAT. There is no restrictions at all. So if you are in the exam and your trainee asked you to sign formative OSAT, please don't hesitate to sign it. Sign it and write whatever you see. Like if he did it, if for example the station was repair of episiotomy and he didn't do it really well. So what you need to tell? You need to tell that you appreciate his like initiative of learning and everything is good in that, and he is willing to learn, and then you can here write whatever went well and whatever could, like, you know, have gone better. Like it should be like if you take the first stitch 1 centimeter in front or half centimeter in front of the apex, that will be better to secure your the first stitch with a good hemostasis. If you do the mucosa with non-locking continuous suture, would be better, like that, like that. So you can write whatever you want here, but you can't tell the trainee, I will not sign for you the form. It's totally unprofessional. Okay, so you sign the form, but write whatever you see. And please don't make the trainee affect your comments. Like I know that sometimes in other countries, that's not in UK at all. Like I'm here for like 1 year and the consultants know me, and I'm now moving my job to another place, and this place wants my logbook, so I'll just take these papers, write anything. Like I have done 100 C-section, I have done 5 laparoscopy, and I haven't done really these much things, and the consultant to he will feel like okay, and then he will just sign. That's not in UK at all. So in UK, every day you have a procedure. If you didn't submit the OSAT on the same day, you may miss recording this event and you will not be signed. The only one who can sign you is the one who was scrubbed with you in the theater, and because every day there are new cases, so if you didn't send it same day, same time, after like 1 week, every one of you will forget the event and you will fail to prove that you have done this one. So if you look on any one ePortfolio, you will find lots of things. I will just show you something here. Sorry. So that's like, if you can see here, these are my own requests. Like till today, I am sending requests. I have many summative, many formative, you know, and these are the records of the procedures I have done, and I have to keep them all the time. Okay, so it's like that. And before I apply for any of these, I have to request the assessment before we start the procedure. Like, you know, for example, this procedure, the last one, which is summative diagnostic hysteroscopy, before I proceed, I asked the consultant, can I do this procedure? Yes. He answered yes. Can I send you a summative OSAT for this procedure? He told me yes. Then I'm going ahead, and he is away. He's just monitoring me from behind. He's not like interfering by any word. He's just looking at my performance, and as if you are in the exam, like doing everything properly, because what you will find, he will tell you whether you are competent or no. And that's the overall judgment here. So that's how the OSATs, the summative OSAT. So that's the procedure, and your name, your trainer name, what are the procedure you have done, and that's what went well and what could have been done better, and what is your learning plan, degree of difficulty, what is the overall judgments, and whether the assessor willing to complete the request or no. Okay, so that's how the summative OSATs done. So the summative OSATs is different than the formative. I'll just show you the summative empty form. It's the same like formative, as you can see, but here there is a degree of difficulty and you must choose one, and whether you requested the assessment in advance or no, because if you didn't request that in advance, you will not be able to be signed for this form. Why? Because as I told you, this is like an exam. So if you ask the consultant or your senior that you want a summative OSAT for this procedure, then he has to monitor you, your performance in everything, including tissue handling, selection of instruments, communication with your assistant, communication with the anesthetist, communication with the patient if she's awake, your way of cleaning and draping the patient, whether you drained the urine or no, your way of putting the speculum, your way of holding the cervix, sounding the uterus, everything you will be assessed for. So if you didn't tell the assessor that you are going to send him a summative OSAT, he may not look at you while you are doing all of these things. So how he will give you a judgment whether you are competent or no? So that's very important. So the degree of difficulty is added here, and whether the encounter requested in advance or no, what went well, what could have been done better, the same, and the learning plan. And here, as you can see, we have the overall judgment. We have one of two choices. Either you are competent or working towards competency. So here I can tell that this trainee is competent or this trainee is working towards competency. The working toward, I can't say he's not competent. It's a better way to say working towards competence. Okay, and that's one of the way of communication with your colleague. So what is the use of summative OSAT? So we told that formative OSAT is just a supervised learning event. But the summative OSAT is assessment of performance. That means I need to be assessed for my competency to be signed off. What is the meaning of being signed off? Signed off means that after having 3 summative OSATs and all the 3 of them stating that I am competent to do the procedure. Competent means you are doing it alone, completely without any help. After 3 of them, all of them signed as competent, and must be with 2 different assessors. It can't be at all with the same assessor. Should be 2 different assessors. One of them must be a consultant. In that situation, you are allowed to go and do the procedure independently without any supervision. Okay, so that's the process of signing off. So if you are the assessor and one of your colleague asked you to come and do supervision on his work, and he will send for you a summative OSAT after that. You can't tell him no, because you have to go and see, like, that's requested in advance. You can't tell him no, I can't. You have to tell yes. You go and see him, and you see from your point of view whether he's competent, sign and reply for him as a competent. You see that he is not competent, you just sign and state that he's working toward competence. Okay, so it will not matter at all if you sign the paper and tick working towards competence. He will not be allowed to upgrade or be signed off unless he got 3 competent. So you can freely say your opinion. So it doesn't matter even if you sign the summative OSAT, you can sign it. And if you think that this person is not yet competent, you just take working toward competence. What is the problem? Okay, but please, if anyone asks you to sign any form, don't tell him, no, I can't sign. You can't tell him like that. You have to sign, respect your colleague, appreciate his wish to learn, but give him feedback and give him the advice. Okay, if you think that he's not competent yet, yeah, you tell him, I'll sign your form, but from my point of view, you still need to work more and do lots of procedure, of the same procedure, because I have seen you doing that, and we will discuss together what could have been done better or gone better next time. I will come with you next time, and if you modify whatever we discussed today, next time I will sign it as a competent, but today I will do it like working towards competency. Okay, so that's it. So as you can see, it's the same. However, this summative OSAT is very, very important to judge, okay, the overall judgment, and not to what I mean, not to tell your colleague in a very bad way that you will not sign his form. No, you sign it, but sign it from your point of view, whether you see him competent or still working towards competence. So you can sign. Finally, we reached the decision finally that you can sign formative OSAT easily without any restrictions, because it's just a learning event. You can even sign the summative OSAT, but according to what you foresee, what you have seen him, if you think he is competent, sign it as a competent. If you think that he is not competent enough, then you sign working towards competence. Okay, one thing I want to tell you about, he must request, if it is a summative OSAT, he must request the assessment before he's going ahead. Okay, if he did in front of you and then after that he came with the paper, please apologize. In this situation only, you tell him, I'm really, really sorry. This form should be requested in advance so that I can supervise you well, because there are many items to be discussed, like tissue handling, procedure steps, use of instruments, communication, safety measures. Everything should be monitored, and I didn't know that you want assessment for this session. So shall we arrange that for the next one or the next time? Yeah, like that. So that's if he, after he did everything, he bring for you the paper and ask you to sign, you then apologize and tell him that form should be requested in advance. I will arrange another session for you and we will have this form signed. I'll promise you, I'll get you a chance to be signed off. Okay, but if he requested in advance. You can't tell him, no, I will not. So if in the beginning of the station, he told you, I came to suture this episiotomy and I need you to sign me the summative all sets, then you tell him, okay, so let's see how it will go, and then I will discuss the OSAT form with you after that. And if you think he's competent, then you sign it as a competent. If he's not competent, you sign working toward competence. There is no restrictions, there is no punishment if you sign it like that. Everyone is getting everyday OSAT here, so we can't really upgrade to any progress in the training without the e-portfolio. The e-portfolio is just a collection of OSATs, formative and summative, and every year your supervisor will sit with you and see how many formative you have got in the same procedure, how many summative in the same procedure, and then you will come with a conclusion what procedures now you can do independently. And according to the new curriculum of the training, then you may pass to the next year and so on. Like if you are ST4, for example, you are requested to do like 1, 2, 3, 4, 6 procedure. So during the year 4 of the training, you will collect evidence of these procedures, formative and summative. And by the end of this year, you will sit with your supervisor, will revise everything you have done during this year, and then he will take the procedures that you have already achieved the competencies. And once you achieved the whole curriculum requested from you during this year, then you will pass and go for ST5 or year 5 of the training, and so on, until you finish the 7 years of training, and then you got your CCT. You have to count all the procedures you are doing every day, and you need to keep an annual OSAT even if you are signed off at least once. Okay, so that's everything regarding OSATs and ePortfolio. If you have any question, please comment under the video, and if you need further explanation about anything, I'm happy to answer your questions. So all the best for you. Thank you.